I'd like to call to order the Hatfield Township Board of Commissioners Workshop Meeting for October 8, 2025. Roll call.
President Zipfel.
Here.
Vice President Rogers.
Here.
Commissioner Andrus.
Here.
Commissioner Lestracco.
Here.
Commissioner Partha.
Here.
I'd like to ask Commissioner Andrus to lead us in the Pledge of Allegiance this evening.
Thank you. I pledge allegiance to the flag of the United States of America, to the republic which stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, not too much of a big of agenda tonight, but important stuff. So let's, I'll entertain a motion for approval of the agenda. Is there such a motion?
So moved.
Motion by Commissioner Lestracco, second by Commissioner Partha. All in favor of moving ahead with the agenda before you say aye?
Aye.
Aye.
Opposed? Hearing none, that is approved. Citizens' comments. Are there any citizens' comments on agenda items? All right, not seeing any. We're going to move on to consent items. Is there a motion to enter into the record the consent items that are in your agenda?
So moved.
Motion by Commissioner Lestracco.
Second.
Second by Commissioner Andrus. Those items include the police reports for the months of August and September, the VMSC monthly report for the month of September, the North Penn Water Authority Board meeting minutes for July and August, the Hatfield Volunteer Fire Company report for 2025, the third quarter, and the Calmer Volunteer Fire Company report for the month of September. With that, I will call the question. All in favor of moving those into the record, say aye.
Aye.
Opposed? Hearing none, that is approved. All right, we have a special item. Shane Wheeler, Chief Executive Officer, Chief, from the VMSC Emergency Medical Services. He's going to give us an update. Shane, always great to see you. Thank you for coming out.
I guess I got the button here. Okay. And Bryson, you want the button? Good evening. I appreciate the opportunity to address the council and kind of give you a little update. We value our relationship with Hatfield. It's one of my Aaron was one of my very first contacts when I started here almost 4 years ago, and I've really come to appreciate his leadership, not just in Hatfield, but across the North Penn, in leading the efforts in public safety, not only with the construction of a new police department, the working with the 2 volunteer fire companies, and certainly the investing in VMSC and working with us to ensure really quality level of service that this community certainly deserves. So thank you. Have you clicked it? All right. So we ran so far year to date, just to give everybody an operational update, we've ran 1,811 responses into Hatfield. Of that, about 86% of those have resulted in a transport. You have one of the most highest transport rated communities in our 20-some municipalities that we service across southeastern Pennsylvania. That is really important, I think, to note that when residents recognize the value of when to call an ambulance and not a lot of frivolous non-EMS related kind of calls that happen here. So we certainly appreciate the residents for that. The top reasons for EMS responses, and we're seeing this trend across our communities that we service, but even nationally, we have this silver wave of boomers and even my generation that are now getting older. Folks are living longer, and falls have become a real challenge in our communities. I've got some approaches we're going to talk about later into this about what we're going to do about it, but it's really a challenge for us on the fall side, and I think so many of those are preventable. It's a loose rug that someone trips over, a small pet, and we've all seen that individual that has been really robust, 85-year-old or whatever, and they've fallen, and then their life goes into a spiral after that incident. I'm happy to report of our fantastic response times. The average response time, this is the time we receive the call to the time we arrive on scene, is under 7 minutes, 6 minutes and 43 seconds. Nationally, EMS agencies strive for an 8-minute, 59-second rule. When I started in this organization, our response times were over 12 minutes due to our shortages in staffing, et cetera, and so forth. So we've literally been able to cut that response time in half, and that is really significant. And it would not be possible without the support of our municipalities through contribution and millage and other things that's allowed us to improve upon the service delivery. Something very near and dear to me is I'm a 1%er. And when I say that, I mean I'm always leaning into things to see what is 1% more or better opportunity for us to improve survivability of our patients. And we keep tacking on those 1%. And as a result of that, our out-of-hospital cardiac arrest survival rates, even here in Hatfield, outpace the nation by double. Represented about 18%, almost 19% survival rate in Hatfield versus a national average of about 9%. Company-wide, we're about 30%, 28%. So we're still low across our region for that, but I'm pretty happy with the idea that we're double the national average on our responses, and I think that's because we constantly are investing in education and new clinical innovations, new approaches, better partnerships. And when we talk about survival, I can't put enough emphasis on the value we place in our public safety partners, particularly the police department, who generally beats us on most of these medical calls, and quite often we see them in the driveway, in the home, with an AED affixed to a patient, doing CPR, and really making a huge difference in our outcomes. Our support from our volunteer fire companies by being there to help us move and package these patients and move in there. It's really a team effort amongst our public safety partners in the community. Early in the spring, VMSE became the elite 1% of EMS systems in the United States with the capability to administer blood. This, in my 36 years in the field, is, in my opinion, one of the greatest innovations in saving lives that I've experienced in our industry. The first would be equivocal with our 12-lead capability, being able to interpret a person who's having a heart attack and being able to transmit that electrocardiogram to a physician to confirm that the patient's having a heart attack early and activating teams is equivocal to what blood administration does in the field. People who bleed to death in the field, who get blood, we improve their survivability by 75%.
Wow.
And so far, across our organization, we've administered blood, I believe, 12 or 13 times. I administered blood last night in the city of Chester on a young man. And here in the North Penn, I believe we've given it 6 times, in a mix between medical emergencies where someone's had a GI bleed and we're hemorrhaging, or trauma-related incident. And it's been everything across the board, from a dog mauling to shootings to medical emergencies. We've administered blood. And I think it's really, right now we remain still the only EMS system in the region that has this capability. And it makes a difference. It's expensive. And there's not a real mechanism for reimbursement, but it's that percentage that we try to do. The reason why we do the things we do is to give people that fighting chance to survive. So really pleased about being able to do that. Late last year, our organization asked the question, how do we know we're doing a good job? We can do it. We're really big on data. You see our reports. We really try to dive in and understand what we're doing, but there was a missing element. We showed that we're getting on scene faster, we're calling our STEMI alerts and stroke alerts faster, we're doing more innovative things, but how do we really know? So we started providing patient experience surveys, and we deliver these in a couple different manners, but the primary way is a few hours after a response, we kind of pull out critical calls, but then you get a text message, and we have a really overwhelming response. We're really surprised at the participation level of that, and really happy that you can see some of the comments here behind me of our ratings. And these are averages that we see. Every now and then we'll get, I think one today, the light was too bright for me. We'll get some, really interesting kind of comments. Sometimes some of them are kind of, well, and we're not perfect. Certainly there are times when we don't get it right, but we're quick to identify when someone doesn't rate us above a 9. And anytime someone has a negative comment, we follow up with them to kind of understand where we failed them. There are challenges in delivering care. As I mentioned, the aging population means that there'll be higher needs for medical services. Nearly 20% of Hatfield Township's population is over 65 right now. The leading causes, I mentioned, are falls, seconded by complex medical emergencies. As we get older, obviously the comorbidities from diabetes, hypertension, et cetera, become more prevalent. Year to date, we ran nearly 900 confirmed strokes in our communities. These are the challenges, I think, that will continue to kind of increase demand for services, for really quality emergency medical services. We're seeing that increase as well. Interesting, funding shortfalls continue to plague the industry. I was hopeful there was a mandatory requirement for this ground ambulance data collection survey, the GADCS, that was forced all ambulance providers in the United States to participate to basically a federal audit. They wanted to see, we kept telling them for years, what you reimburse us at Medicare or Medicaid rates does not meet the cost. Well, they wanted us to prove it, so they made us go through this really rigorous, not just us, everybody, this survey, and looked at all of what do we spend our money on, from toilet paper to tires. And they did a report. We just got that report earlier this year, and it confirmed exactly what we had been saying as an industry for so long. The first year survey surveyed approximately 3,600 ambulance providers across the United States, and the average cost of an ambulance transport amongst those 3,600 transports, based on the federal government Centers for Medicaid and Medicare Services, was about $2,600, where Medicare typically reimburses us somewhere between $400 and $500 on an emergency call. Last year, in 2024, VMSE had $1.2 million in uncompensated care in our North Penn communities. These were patients that did not have the ability to pay, or quite frankly, chose not to pay us. Unfortunately, in Pennsylvania, they are not a direct pay state. So the insurance lobby tries to force the ambulance providers to join their networks at much lower prices than what it should be. And if you don't, then they mail the check for their services directly to the beneficiary. And if you're on a fixed income and you get a check for $800 or $1,000, your intention might be to pay us, but maybe only $10 a month. So we struggle a little bit with that world in the uncompensated care world. Obviously, the federal government, barring politics aside on this, has been really challenging to work with in the last 10 months or so. and which we were hopeful with the information supporting the ambulance industry and professions claims of gaps in funding, that they would respond to that. And then came Elon and Doge. So any thoughts of getting increases from the federal government is probably unrealistic. So those are challenges. The cost to provide those advanced cares, as we've seen in the fire service and other things, so the price of a fire engine has skyrocketed to $1 million when private equity owns all of the fire equipment manufacturers in the United States, so they can fix those prices. We're seeing private equity's impact on healthcare. Our operations in Delaware County, following the collapse and bankruptcy from Prospect Holdings' Crozier Health System, is evident of the impact of private equity. And we're fighting private equity, tariff, supply chain cost, expirations in tax credits and credits for insurance premiums. All those things impact our ability to operate, not just ours, everybody's, our homes, right? So these are challenges we face in delivering care. Now, we talk about our patients. If it was not because of the municipal support that we receive from communities like Hatfield, we would not be able to save the number of lives that we've saved, would make the difference that we've done, or roll out new programs like our community paramedic program. This community, along with the other North Penn and Indian Valley communities, reached out in letters of support in our Safe Streets for All grant application sponsored through Montgomery Township. And we appreciate that endorsement and support. And because of that, we were awarded $2.4 million on a $3 million shared grant to reduce traffic-related morbidity and mortality from traffic-related incidents. So we're going to use that. Our thought process behind how to reduce that is to improve access to ambulances by reducing access to ambulance. And how I want to clarify that by saying about 30 or 40% of all the responses that we do don't necessarily require an ambulance, right? Maybe somebody just needs help up, or a pain call, or toothache, or you'd be surprised what people call an ambulance for sometimes. If I can keep my ambulances in service to respond to traffic-related incidents, well, then I can improve survivability and reduce morbidity and mortality associated with traffic-related incidents. And as such, to address our silver wave, we will be launching a community paramedic program across our 911 operations in the region. This specially trained paramedic or nurse, we have both, will respond to those lower acuity calls, work through telehealth protocols and technology to get people care they need that may not necessarily be an ambulance. We can't continue to send the most expensive mode of transportation to the most expensive healthcare option, an emergency room, right? So if we can address those needs with a specially trained clinician that can do labs right there on in someone's residence, do an ultrasound right there in somebody's residence, connect them to a emergency room physician via telehealth, and we could administer, whether that's antibiotics or other medications that can be much more effective in getting their care right there in their home, and then coordinate them and collaborate with care with getting them with a primary care physician, because so many of the patients that we respond to, you would be surprised, do not have a primary care physician, that they get their primary care from an emergency room or from an urgent care. So we can establish a relationship and connect people to a physician in the future. We hope to launch this program in mid-2026, and this will be funded through this $2.4 million grant initiative to address that. Part of their role will also be working with them to do in-home safety inspections, to identify fall risk hazards and other safety-related issues, helping people understand their medications. We have a high medical illiteracy rate in our communities, meaning that you can talk to someone and they may think, well, we'll say, do you have hypertension? And you're like, no, I don't got that. I have high blood pressure. Well, it's the same, but they don't understand that, or they don't understand when to take or how to take their medications, or there's no medication reconciliation to where they've gone to this urgent care and they went to this urgent care and this pharmacy, and they never threw away their medications. They just kind of take them in and not realizing that their medications are interacting and not helping them at all. Right? So I want to thank everybody for their continued support. We're really excited about our agreement on the lease of the soon-to-be former police department. We've got some really exciting plans. We've been meeting with some folks on the engineering side and trying to work out, what is it going to look like. But we're really excited about where this new partnership. We hear and echoed the concerns of the community about lights and sirens and ambulance. It's not going to be an ambulance station. It'll be serving in administrative or educational kind of roles. So there shouldn't be anybody running lights and sirens through there. But thank you. I'm happy to answer any questions that anybody may have. Just wanted to give you a little update.
Any questions? Chief, let me be the first to mention that I know you've been here for a few years, but VMSC has seen, even from our perspective, enormous improvement and strides in so many different areas. So, we are thrilled to have you serving our area. I want to say thank you to you and your entire staff, because I know that there's been such a significant and dramatic improvement that we're just thrilled to have you.
Thank you.
And as I was watching the presentation, I saw a turn of a phrase that I thought kind of sums up everything that you guys do. Put the medical side part of it aside. I wrote this down. You give families more time together.
Yes.
And that's the goal, is to hopefully at a terrible time, you find a way to get them back to where they were so that they can spend more time with their families. And I thought that was just a compelling slide that you had there. And so I want to thank you. It's a very admirable goal, and we appreciate everything you're doing.
I appreciate the comments, and thank you.
Anybody else? Any questions? Residents? No? All right. Well, thank you. We look forward to you being right next door soon.
That's right.
That means you have to go to all the meetings. No.
Thank you.
It's hard to get to every municipality.
Thanks, Chief. Thanks to all of you.
Guys, have a good night.
All right, we're going to move on to our committee reports. First is Planning and Zoning Committee. Vice President Rogers.
First one is North Bend Imports, the amended approval.
Thanks, Vice President Rogers. I think we're going to throw this over to Brian's going
Brian,
to
do you
just
have
give
this?
a quick summary on a minor item here.
Yeah, this is it's really a housekeeping item. The board had recently approved the North Penn Imports land development, and in going through the check set review, we realized that one of the items that had been in one of my reviews didn't get carried over to the resolution, and frankly, it was a waiver for the number of parking spaces in a row without a curbed island. Staff had discussed it and was fine with it. Planning Commission was fine with it. I missed it when we reviewed the resolution prior to it being adopted. So this is really just an amended resolution to make sure that that waiver is included. Pretty straightforward. We're still working on the check set with the engineer. So at the regular meeting, the resolution will be in front of you for approval, and then eventually the plans will be recorded.
Brian, you just want to roll right into item number 2?
Yeah. So the next one is just as straightforward. The Wawa at Cowpath and Broad is complete. In our correspondence from late August, we recommended the project be accepted as complete. Everything's been done. Punch lists were taken care of. So there's one final escrow release to approve and start the project into the 18-month maintenance period. So at the regular meeting, you'll have a resolution in front of you ready to do that.
All right, pretty straightforward. Bob, anything else?
That's it for tonight. Thank you.
All right, we're going to move to Public Works Committee. Aaron, I think you have this one.
Sure, thanks, Mr. President. Just a brief update, just reminding residents that our leaf pickup begins in the next few weeks. We have a pickup on November 3rd, November 17th, and December 1st. More information is on the website, and we'll be promoting it regularly on Facebook just to make sure as many residents can participate as they do most years. So that's all, Mr. President. All the paving is completed as you drive down a nice, smooth Cowpath Road. Hopefully, everyone's enjoying that and some of the residential neighborhoods that we paved this year. So a good year for Public Works, and we'll talk more Public Works next week in the budget meeting.
In the budget, right. All right, moving right along to Parks and Recreation Committee, Commissioner Lestracco.
Thank you, President Ziffel. I just want to thank everybody who was able to come out to the Hatfield Rocktoberfest and Fall Fest 5K. I see some volunteers here in our audience, so thank you for volunteering for, I think it was the race, right? Yep, thank you. Congratulations to our Fall Fest runners. It was a beautiful fall morning for a run, and we just had a great turnout, and everybody had a great time. Thank you to our vendors, crafters, businesses, organizations, and groups that came out. We obviously we had great weather. We had really large crowds and so much fun. And we want to thank our Parks and Recs department, our staff. Everybody just was there and helping, and it was a really great event. So thank you. Also want to do a special thank you to Vinny's Pizzarama, Harleysville Bank, Univest Financial, and TD Bank. So thank you, everybody. I'm going to go into our fall fitness classes. So that will begin October 26th. Fall Zumba will be Sundays at 9 a.m. October 26th to December 14th, with no class on November 2nd or November 23rd. And that's a 6-week session, $60 per person. We also have Fall Remix, that's Mondays, 7 p.m. That will begin October 27th to December 15th. No class on November 3rd or November 24th, and that's also a 6-week session for $60 per person. We will have Fall Yoga, Thursdays, 7 p.m. That will begin October 30th, and that goes till December 18th. And same thing, we will not be in session November 6th or November 27th. And it's also a 6-week session, $60 per person. Just to announce some upcoming events, we will have the Giving Tree. That is our Hatfield Parks and Rec and North Penn School District partnering. This is the 7th annual Giving Tree, and we will be collecting items in our lobby here at Hatfield Township, November 17th to December 12th. And you can take an ornament off the tree, and then that will correspond with a gift that somebody's looking for, and that would be a new and unwrapped gift. And so there's a lot more information on our website. Also, we have the Holiday Lights Contest. You can register your home for free and participate in the 6th annual Holiday Lights Contest. You can submit 2 photos of your decorated house to holidaylights@hatfield.org, and the winners will be selected in the following categories: People's Choice, Most Colorful, Most Creative, Most Traditional / Classic. Judging will take place between December 14th and December 20th, and the judges will be our Parks and Rec Board. Winners will be announced on the Township Facebook page early in 2026. And registration and photo submission deadline will be December 12th. So be thinking about that. And please also check out our website, hatfield.org, for more information, registration, and programs. Hold on, not done yet. The Mini Monster Halloween event will be Friday, October 17th. Again, that's Mini Monster Halloween event, 6 p.m. to 8 p.m., and that will be at School Road Park. There'll be snacks, refreshments, games, music, crafts, pumpkin decorating, balloons, face painting, mini monster truck racing, and trick-or-treating. Lots of vendors, businesses, and organizations will be on hand, and be sure to wear your favorite Halloween costume. And then in December, Santa event, I'm going to talk about that next time. But be looking for that on December 13th, so you can put that in your phone. That's this big Santa event. Thank you very much.
Nice. If anyone thought that because fall was beginning, that the Park and Rec group was going to slow down, clearly that indicates otherwise. So, great list. All right, Public Safety Committee, Commissioner Partha.
Nothing to report.
Nothing tonight? Okay. Finance Committee, Commissioner Andrus.
Yes, there's no official update tonight, but we will be spending a few hours talking financing and budget next week at 6:30 p.m. in this room. So please come and join us for the 2026 project list and what we're going to wind up planning for next year. I will, however, make an announcement. All signs point toward a 12th straight year with no tax increase for our working residents of Hatfield Township. That's a large part to what the Aaron does with the staff and chief of police and all the work that gets done locally. So thank you, guys. Appreciate it.
Yeah, well done.
Thank you.
All right, we'll have a big round of applause when it gets passed, and as we go through the budget process. That's good news. That's a great teaser too, by the way.
Yep.
That means, now people are going to be interested and want to come to our budget meeting. Yep. So, all right, let's go to the Township Manager's report. Aaron.
I think we balanced the budget. We cut Chief's clothing allowance.
Yes.
That was
Yes.
how we covered that gap. Thank you, Mr. President. No more pink shirts for Chief. Just a few items tonight, Commissioners, and just a reminder, the same as Commissioner Andrus mentioned, next week our budget meeting in this room at 6:30, where we'll go over everything for 2026. Another reminder, too, Commissioner Lestracco reminded me, our meeting schedule for November and December will be the third Wednesday of each month, only the third Wednesday to avoid holiday schedule. So we'll advertise that and put it on the website, but just a heads up to those who like to attend. Then also, earlier this year, we did a survey at the end of our season for the Aquatic Center. Scott is going to go over some of the results and feedback that we got from our customers. Let me pull up this PowerPoint. All right, Scott, take it away. What did we learn?
It's only 137 slides. I'll keep it short. Yeah. We want to get a sense of how our patrons felt about the 2025 season. We do have a fantastic facility, but always want to see how we can keep moving forward and keep improving. These questions were geared towards every aspect that surrounds the facility: cleanliness, staff interaction, hours, safety measures, communication. That's the list right there for everything. We really felt like this hit all bases of what we do there. In the end, we had 175 responses, so that's a good solid chunk to get some feedback from. Started off with our visitation. Want to know how often people are coming there. 80% said that they come daily to weekly, and that's some very dedicated patrons. Shows the operation is running in the right direction, that they keep coming back so often. And also, when you do come, what is your primary reason for visiting? The largest percentages coming from recreational swimming and family outings. Great responses, really speaks to the atmosphere the staff has created. The cleanliness of the facility and the pool and the surrounding areas. 98% rate as excellent or good, and that's really just phenomenal work by Mike Cruson and his team to ensure that the facility stays in its shape that it is in, especially given the volume of people that traffic through there throughout the day. Our staff interaction, we really want to know how the staff are treating the people that come through the door and what their thoughts are on that. 94% are very satisfied or satisfied. Again, we have a solid team of managers headed up by John Taylor, constantly stressing the importance of staying on point, and clearly shows by these results. Pretty straightforward, our hours of operation. What do you convenience for you? Overwhelming yes with 80. Some of the people who did not find it convenient answered why in the open-ended question. Those responses were really geared towards having later hours or opening earlier for members. I think this is probably maybe the most important piece of it. With the facility this size, safety is the priority, having an environment the community can feel comfortable in. Again, Mike Cruson and John Taylor really lead the way on this one. Cruson managing the infrastructure. We have constant discussions about what's needed short-term, but also long-term, and those issues get addressed through the budgeting process for those big-ticket items. And John Taylor does a tremendous job getting our lifeguards in a position to do their job correctly. So much training's put into it, and the staff recognizes it and takes ownership of that. Communication. This category is a great window into how we can get better about communicating everything happening at the Aquatic Center. Partway through the year, we implemented the text message updates that our members can opt into. 37% is a great figure considering it hasn't been an entire year. Next season, we'll start promoting this at a higher level during the registration period, so hopefully that number keeps going up. And as always, social media remains the highest, and we're going to continue to put updates on that platform as well. Rates. It's a constant debate, not just with us, but with every township pool facility. We do our best to keep it reasonable, given the amenities and level of staffing that we have. It's a fact that costs are rising to run the facility at the level to what people expect. I believe 69% stating the prices are reasonable indicate that we are on the right track with this. Our concession stands offering 99% rate from excellent to fair, which is amazing. We think the prices are fair and the products are pretty wide ranging, but as always, we look to expand the menu when we can, given some of the feedback on the open-ended questions. And these are some of the high points that were featured throughout it. It's great to see so many responses come back with nothing, keep doing what you're doing, but we do want to hear what could be tweaked and to improve everyone's experience for the next season. Chairs were a social media topic of discussion earlier in the year. We try to balance putting the appropriate number out, considering we don't want the crowd directly around the pool in case our guards need to act on any situation. Shade structures are a part of our long-term planning goals, given the costs that are associated with them. Events, people like them so much they want more, so we can certainly work on adding to the current schedule. Hours for classes and lessons, we can discuss this and see what can be tweaked to not compromise our members in the later hours that the facility is open. And concessions, some healthier options have been suggested. This is something we can discuss and see what can be available given our limited access and not being a complete full kitchen at the Aquatic Center. So I believe 2025 was a great season, and we know where the community stands in their responses with these results, and we'll give this info to the pool board and go from there.
It's good feedback, very good feedback, and thank you to everyone who contributed to that, because people are oftentimes reluctant to share their opinions in a kind of a thoughtful way, so that's very good. All right, any other questions, comments?
That's all we have, Mr. President.
Anything else for your report?
That's all for tonight.
All right, Solicitor's report. Mr. Solicitor, anything this evening?
Nothing to report tonight.
All right, that's good to hear. Citizens' comments. Are there any citizens' comments on agenda items or otherwise? All right, well, there's two quick announcements I wanted to make. First is that we are going to executive session to discuss personnel, but also we wanted to welcome back some dear friends, Tina and Bob, tonight, for not just being great volunteers, but just, for being great residents. We greatly appreciate it. It's fantastic to see both of you. Thrilled to see you here. Many, many more meetings with you, the two of you here, so great to see you. Yep.
Mr. President, you just have to announce you're not returning from exec session.
Okay. After our executive session, we will not be returning to this room. The meeting will be over. And so I think, are we good?
Yeah.
All right. So is there anything else for the good of the order? If not, I'll entertain a motion to adjourn. Motion by Commissioner Partha.
Second.
Second by Commissioner Andrus. Any questions or comments? Hearing none, I'll call the question. All in favor of adjournment, say aye.
Aye.
Opposed?
Aye.
Hearing none, we'll adjourn and see you next time, folks. Thanks for coming out.